Okay, so now we're going to talk about Parkinson's disease, and this really should have been in the neurological lecture, but that lecture was getting too long, so I moved it to the spinal cord lecture. So with Parkinson's disease, this is characterized by resting tremors, which is different than multiple sclerosis because multiple sclerosis, they have intentional tremors. Resting tremors happen at rest. Intentional tremors happen when you go to do something, like you go to take a drink or something. That is an intentional tremor. Um, Parkinson's disease is also characterized by slow movement. This is called bradykinesia. Okay, they're going to have stiffness. Often it's called cogwheel rigidity, which means I don't know if you've ever tried to take a shirt off of somebody with Parkinson's. They can get really rigid when you're trying to do that. They can have balance problems, so they're going to be fall risk. They have problems with their blood pressure, their heart rate. They're going to be very fatigued, and they could have constipation. The reason for Parkinson's disease, it's a progressive degenerative disease that is caused by gradual loss of the nerve cells in the substantia nigra. And these nerve cells usually release dopamine. So it's from a lack of dopamine, because dopamine usually relays messages and helps us with our coordination and thought. There's also nerve endings that secrete norepinephrine, so the patient is fatigued easily and may have changes in their blood pressure and heart rate. With Parkinson's disease, there is a genetic risk factor. Chemicals can also cause Parkinson's disease, and this would be like pesticides. Um, they have been linked to Parkinson's disease. So obviously, you should tell anybody that has one of those jobs to make sure they wear all the protective gear. Heavy metals may also put a patient at risk for Parkinson's. Anybody that's had a traumatic brain injury is at risk for Parkinson's. Diabetes, of course, diabetes is a risk for a lot of diseases we talk about. And those with metastatic skin cancer are also at risk for Parkinson's disease. You can remember some of the cues by the mnemonic B SMART. So B stands for bending or forward tilt. So it's often called a stooped posture. S stands for shuffling gait. They have a shuffling gait, meaning their feet shuffle on the floor and they kind of speed up as they go. So ask me to demonstrate this in class and I can do this well for you. M is mask-like face. So their face is like a mask, like their effect is not they don't move their face. A is for akinesia, so that means lack of movement. R is rigidity, and I talked about cogwheel rigidity. And T is for tremor, and it's a resting tremor, most commonly described as pill rolling. Like you'll see patients sitting there with their arms, on their legs while they're sitting in a wheelchair, and you'll notice their thumb and their index fingers, they're doing like a pill rolling movement. Recognizing cues, again, the signs and symptoms. So the triad is the resting tremor, bradykinesia, and rigidity. Stoop spot, posture, shuffling gait, and mask-like face. Those are the most common signs and symptoms you're going to see. Again, recognizing cues. Remember, this is a progressive disease. So as the disease progresses, the cues are going to get worse, so to speak. So like drooling, dysphagia, that means trouble swallowing. I've taken care of several patients with Parkinson's disease who have died from aspiration pneumonia. So you have to be extremely cautious when feeding somebody that has progressed to the dysphagia stage and is drooling a lot. So they have that difficulty swallowing. They need to be evaluated by a speech language therapist and put on, so they can do a swallowing study to see what kind of foods are best for them. Diaphoresis, flushing, and orthostatic hypotension. People can lose their sense of smell like 20 years before they develop Parkinson's disease. Safety is going to be the most important goal to have. You want to keep the patient safe. Their risk for aspiration, I talked about that. Most patients with Parkinson's die from aspiration pneumonia. So make sure you're doing all the things to prevent aspiration, like sitting up, tilting their head forward when they eat, not letting them use straws. Um, they're also at risk for falls. So do all your fall precautions and wandering. So we talked about the interventions for aspiration, falls, pneumonia, and wandering in MedSurg 1 when we did the dementia lecture. So make sure you review those interventions. We talked about interventions of taking care of someone with a progressive neurocognitive disease. And a neurodegenerative disease is very similar. So please go to your Parkinson's disease chapter in your MedSurg ATI textbook and read about patient-centered nursing care. It's all the things you learned in fundamentals and also in MedSurg 1 when we studied dementia. Okay, Parkinson's disease is managed with medications. They must be given on time. You can remember them from the mnemonic SALAD. Silagine is a Mayo inhibitor, so you need to understand that you can't give these with taurine-rich foods, or they're going to get malignant hypertension. Anticholinergics, make your mouth dry. Levodopa and carbidopa. Imanitin can make people have insomnia, so make sure you're giving that early in the day. And dopamine receptor agonists can also be used in the treatment of Parkinson's disease. Here's the food to avoid when on a Mayo inhibitor. Aged cheeses. So this doesn't include cottage cheese, so make sure they're aged or hard cheeses. You can read through the rest. I think you probably remember from pharmacology what you're not supposed to eat, but this is always like highly tested, so make sure you really understand what they can eat.